Good afternoon. So we just finished a tummy tuck liposuction with fat grafting to one side of one breast, basically. So fat grafting is a very common procedure in plastic surgery, and you've heard of BBL or Brazilian butt lift. We do fat grafting for the face, but we also do it for the breast. And oftentimes people ask, can they do a breast augmentation with fat? And shorter answer is not really, not unless you're looking for a fairly small volume breast, because the way that fat heals, we have to harvest double the amount of fat that we want to inject, because essentially fat that we put in, we can expect 50 to 75% to stay. And in the breast, we're usually dealing with a tight skin envelope, so that restricts blood flow, restricts the fat's ability to expand. So, short answer, we do breast fat grafting usually to help with symmetry between breasts. Sometimes in breast reconstruction, there's some contour irregularities that we fix with fat. But again, fat's a great process for face, breast, buttocks. Today we did it in the breast. Many times we're doing it in the face for aesthetic purposes to restore volume. And the good thing, everybody hears filler of the face. Well, fat is a natural filler. It's from your own body. And if you can see, we harvest it, and there's various methods of cleaning the fat. Anywhere from just letting it sit and let the fluid separate to actually using a strainer device. Also, some people spin it in a centrifuge. But it basically comes up to the consistency of almost like a thick paste, and we can see it kind of laying out here. And this is just one type of cannula. This is a fairly large cannula, and they get even bigger. And you can imagine, this is a 10 cc syringe, and cannulas we use in the face are maybe even a quarter of this, because we use some very small cannulas to have small volumes delivered in certain areas. So fat grafting, great procedure for volume. In the buttocks it's usually large volume, in the face it's usually small volume, and in the breast it's, let's say, in the middle of the road. So have a great afternoon, and we'll see you during the next surgery.